Good day, ma'am. I am Stephanie Pedri from Butuan Doctors. I am going to be your nurse for today. So may I ask for personal data and verify your identity? What is your name?
My name is Hannah Lee.
Hannah-Lee. Okay, Mrs. Hannah-Lee. How old are you?
I am 29 years old.
From what barangay?
I'm from Barangay Tugbok in Davao City.
Okay. Your status?
I'm married.
Okay. Occupation?
I'm a homemaker.
Okay. And educational attainment?
College graduate.
Ethnic group?
Tagalog,
Dialect language spoken?
Filipino and Bisaya.
Okay.
The nurse will get the vital signs, BP, pulse rate, respiratory rate, and temperature. It is important for the early detection of problems in pregnancy. Early identification of abnormal vital signs can help for early intervention and planning to minimize the risk for the mother and the baby. Provide for client privacy by closing in the doors, windows, and the curtains. We assess abdominal appearance, measure fetal growth using a tape measure from symphysis pubis to the top of the uterus. And then we perform Leopold's maneuver. It helps determine the position and lie of the fetus, which in conjunction with the correct assessment of the shape of maternal pelvis can indicate whether the delivery is going to be complicated or whether a cesarean section is necessary. The nurse will perform a Doppler ultrasound to hear the fetal heartbeat.
Sumasakit at namamaga po ang paa ko ngayon na ako ay buntis.
We assess pain and inflammation of the patient's legs because this can be used as baseline data to assess if there will be any changes in characteristics of pain and determine if there is any development of complications. We have to inspect and note the appearance of the affected site, note location characteristics.
So, ma'am, pwede niyo po ba i-rate from 1 to 10 ang sakit sa inyong paa?
6 out of 10.
Assist client to explore pharmacologic and non-pharmacologic methods to alleviate pain. It will help to reduce pain or to maintain pain within tolerable limits through the usage of safe pregnancy pain alleviation methods.
Ma'am, gayahin niyo po ako sa paghinga. Inhale, exhale. Inhale, exhale. Inhale, exhale. So, ganyan po yung gagawin niyo kapag sumasakit ang inyong mga paa. Pwede rin kayo manood ng TV o magbasa ng libro para ma-distract kayo sa sakit ng inyong paa. So, ma'am, I am going to discuss the cause of varicose veins, how it occurs, and why it is painful. Varicose veins appear when veins of the legs swell. And then, in pregnancy, there are also many changes that increase the risk of hemorrhoids. And varicose veins, which is yung nasa likod sa inyong mga binti. Such as increased blood volume, which enlarges the vein. The heavy weight of the growing baby, which presses enlarged blood vessels in the pelvis, altering the blood flow. Varicose veins often get better after delivery when the uterus is no longer pushing on the inferior vena cava.
Normal po sa inyo na mag-gain kayo ng weight ng 0.5 lb to 1 lb kasi ganun po yung nangyayari kapag ikaw ay nagdadalang tao.
Document interventions and patient response to the treatment regimen. It is important to document every nursing intervention done to the patient because if an intervention is done but not written, it will only indicate that it is not done yet on the patient. It will also help to identify useful methods to alleviate pain and to rule out if there is any development of complications.